So, Stephen, first, let me just say thank you. Thanks for joining me on a CancerVac CEO chat. We do these little chats. It's almost like a short form podcast where this is not about my company per se. This is about connecting with like-minded individuals in the biotech space because it's a big deal. It's important to the research, the R&D, and you've lived this at Pfizer, and we'll get into your bio a little bit here, but the research and the work that goes in, the money, the time, et cetera, that goes in to making drugs that really truly change and save lives, it's a big deal. And so that's what really these CEO chats are about, is finding like-minded people who are also working to try to help humanity. So thanks for joining me.
It's a pleasure to be here, and thank you for inviting me, Ryan.
Yeah. So, Stephen, I'm going to start by this is going to be an attempt of me trying to give your bio. And so if for any reason I mess up or whatever, correct me. But as far as I can do, here's my best attempt. And it's an impressive bio, by the way. But you graduated with a BA in International Relations and Politics from New York University, NYU.
Yeah.
Before I go on, and I probably shouldn't stop here, but I'm going to. I have a daughter who went to Parsons, who's
nice,
which is kind of connected to NYU.
My sister-in-law went to Parsons, and she studied photography. Yeah, she's great.
Lovely. It's awesome.
A great school. Fantastic school.
It really is a good school. So yeah, so my daughter lived in Manhattan and did 2 years at Parsons, and then transferred to a school called the Art College, the art school, actually, in Pasadena.
Which is very well known. A school. It's an exceptional school.
Yeah, really is. And so yeah, when she went into Parsons, she was film editing. That was like her shtick, right? And then she realized no, it's graphic design. And so we thought, all right, well, it's graphic design. What's the very best graphic design school? Yeah, well, she goes to the other side of the coast and at the art school. So that's
she's bicoastal. She's bicoastal, your daughter.
Yeah, absolutely. She is bicoastal. Yeah. So after NYU, Stephen, you became, well, actually at NYU, you were a parliamentary debate candidate, right? You were on the debate team.
It's true. I was a master debater.
Which is super cool. One of the things in high school that I always wanted to do and never did do was debate. Yeah. I was elected to public office. I was a city council member for a number of years in a suburb of Salt Lake City, and we followed the parliamentary procedure, and I really grew to love it. But the whole debate scene is super interesting. It always has been super interesting to me. But you guys, your team actually went on to compete, right, at Oxford University, and I believe the World Championship. Tell me about that.
Yeah, no, sure. It's first off, Oxford is a magical place. So is Cambridge. If you haven't been,
I have been.
Yes, I was joking before. I was a decent debater. The debate tournaments in college are done on the weekends, and so to be really good, you have to go every weekend. I had to work in college, and so I could only go a couple times each semester. But I thoroughly enjoyed it, and it's great training for any endeavor. This is extemporaneous, so you really have a few minutes to prepare. You give it a resolution. You have to structure a case, and it teaches you to think quickly on your feet, be analytical, and I think it's great training, like I said, for anything you do.
Well, I think this interview is a perfect example, because I called you about 24 seconds ago and asking if you'd be willing to do this interview, right? So
it was 30 seconds. You're exaggerating.
No, actually, that really is cool. I have our youngest children. My wife and I have 2 twin daughters who are 12, and one of them is she's going to be a debater.
Good.
Yeah, it's fun. It's really a lot. It's a fun thing. It's good to learn. It's fun to learn about, events. It's good to, be able to talk on your feet and anyways, good training.
Yeah. No, I love it.
After NYU, you graduated from William and Mary Law School. Yeah. And actually, we're on the law review there, which,
I was.
people who don't understand like law school, being on the law review, that's actually a pretty big deal.
It crowns you as an uber nerd, absolutely,
Right.
in that sense. But no, thank you. You're being very kind. It
I
was great.
understand what that means.
Yeah, it's heavy on writing, reading, analytics, and to be honest with you, nice compliment to the debating and the oral
Yeah.
skills that I tried to pick up in college, and so it's just a great experience and a great opportunity. And I was fortunate to make the law review.
And after I have a number, I grew up in Southern Florida and have a number of friends who went to William and Mary. Very good school, very, very good school. So, but after William and Mary, you actually continued your legal education by studying at the University of Nairobi.
I did a summer there, yeah.
National Law Institute. Tell me about that.
So I spent a summer there, and the idea was I knew that once I started working at a law firm, I wouldn't get too many opportunities to spend time abroad. And I've always wanted to go. I had always wanted to go to Africa, East Africa in particular. Just a lot of what I'd read when I was a kid, and was really just knew that I could either do it when I was 25, 26, or I could do it when I was 65. And I liked the excitement and the adventure better at the younger age than at the later age.
Yeah, totally.
So we studied it a few days a week. Then we would go on the weekends and do a lot of traveling. They had a little break, and I was able to climb Kilimanjaro, which was great. And it was an extraordinary experience, and really just changed my outlook in so many ways.
Yeah, that's really, really cool. What were some of your biggest takeaways outside of climbing Kilimanjaro? That in and of itself is a huge accomplishment.
It was one of the main things I took away really was I love language, and I made a very concerted effort to learn Kiswahili while I was there. And it was really interesting to see how quickly you could develop a bond with someone locally by being able to speak, even if it's just a little bit of their native language, and just they instantly recognize the effort you're making to connect with them and to understand their culture and their language. And I started with a number system, which is the easiest way to I think to learn a language, and then work my way from there. And I would go into the market, and the Swahili word for a tourist or white man is mzungu. And so I'd walk in the market, and all the shopkeepers.
Mzungu, is it Misungu?
It's actually Mzungu, Mzungu. So there's no vowel between the M and the Z, so it's Mzungu. And they'd say like, oh, Mzungu, to let each other know, hey, here comes a tourist who's gonna buy stuff at an inflated price. Yeah, right. So I would look at them and I'd respond, Mzungu, wapi Mzungu, which is where, wapi is where. And then they'd laugh, they'd say, wait, Mzungu. And I'd say, Mimi, hapana, Mimi wananchi. No, I'm a native. And then they'd start laughing, and we'd have right away break the ice with people I didn't know 10 seconds before. And so that was extraordinary. And then just the landscapes, the wildlife, just you really do. I don't know anyone who's gone there, and it's probably a little bit of a cliche, especially for Mzungu, but I don't know anyone who's gone there and hasn't come away changed in some way, in a spiritual way. I'm not a highly religious person, but you do. It is hard not to be humbled by the beauty and the landscape of the Serengeti.
Well, I think what I was trying to say is, I think it's for me personally, it's even bigger than that. The Serengeti, obviously, I've never been there, but I can imagine that just is a majestic spiritual experience, just looking at the creation of what it is. But yeah. I also think that experiencing the humility of those people, or people of other cultures, really kind of gives a connection, whether that's spiritual combined with just our common bond of humanity. It's pretty cool.
Yeah, the Kenyans and the Tanzanians were very warm people, and I have fond memories of my time there and of them as well. Just they were very welcoming. It was a great summer.
I lived 2 years in southern Brazil as a Mormon missionary.
Right. Tudo bem.
Yeah, tudo bem. That's right. And it's kind of interesting because I grew up in Southern Florida and learned Spanish in high school, and a lot of people around me spoke Spanish, and then I was submitted my paperwork to serve a mission for my church and got called to Brazil to speak Portuguese. And the funny thing is the way that it works in the Mormon church is I was sent off to a training center for 2 months to learn how to speak Portuguese, and
Right.
it was really like rudimentary stuff. Where's the bathroom? Like, how do I eat? Like, my name is whatever. And but I didn't get my visa. We had some complications. This was back in the early 90s, and we had complications, and they sent me over to Phoenix, Arizona, while I was waiting to get my visa to go to Brazil. And I arrived in Phoenix, and the mission president there. So you have essentially a retired executive who's now like kind of shepherding and helping these young missionaries like such as myself. And he said, "Hey, listen, I understand you learned how to speak Portuguese, so I'm going to put you in the Spanish speaking area." And so for 3 months, I was speaking Spanish in Phoenix, and I got pretty proficient in Spanish. And then I got my visa, and they sent me down to Brazil, and I completely forgot how to speak Portuguese. And the Brazilian people used to always make fun of me for the first couple of months, saying, "You're the only American I've ever heard speak Portuguese with a Mexican accent."
Nice. I gotta hand it to you. This is something I think the Mormon Church does a great service to its youths by having institutionalized this mission program. And I think if you choose wisely, you can have an incredible experience. And it really just opens you up. And I think so many Americans don't have that immersion at a very young age. It can be tremendously life-changing. My dad worked for, you can see over my shoulder, Pan Am. So we used to travel a bit when I was young because he had the travel privileges. And so at a very young age in the 70s, didn't have a lot of money, but we did have travel benefits. And so we got to see a decent amount of the world and just really inform my perspective. And for, a 17, 18-year-old kid, 20, to then go off on a mission in a country they've never been in before and really immerse themselves, I think is just an incredible experience.
You've had a very successful career. You worked for DLA Piper, Sidney Austin, which is a very, very, prestigious, well-known law firm, AIG, Citi, Milbank, Barclays Capital, Axiom. And then when you and I met, you were the assistant general counsel for business transactions and M&A at Pfizer.
Mm-hmm.
And that was sort of an interesting meeting, I think, that you and I had, because we have a mutual friend who had introduced me to your wife, who was then working at CNN. And I was in New York City for two reasons. Number one was to meet with Pfizer.
Right.
And number two was to be interviewed by CNN. And in my Pfizer meeting, in walks this dapper, handsome man named Stephen.
That must have been a different Stephen.
Yeah, that's how we met. It was pretty cool. I'd love to hear. Tell me a little bit about this career trajectory and how it started, and I know that you're beyond Pfizer at this point, but so just give me a little background of how it happened and your career trajectory, and then where you are now.
And the short answer is the headline is kind of accidentally. Growing up, I had always wanted to work on Wall Street. I read Liar's Poker and Barbarians of the Gate at a very formative age in high school. And so I had always wanted to be a banker. And then I got to college and I took finance and accounting, and the accounting didn't work out so well. And so I decided to pivot. And I said, I was working at a law firm on the weekends at the time, a law firm called Cravathar and Moore. It's a top law firm. And I saw the work that they were doing, and I got to know some of the lawyers there. And I thought, maybe I should do law, and I can do corporate law, which is close to the banking. And so I decided to pivot and decided to go to law school. When I graduated law school, I went, as you mentioned, I went to work for a Wall Street law firm. And I didn't love being in-house because I wanted to be closer to the work. And one of the challenges that some lawyers at firms encounter, and they will often ruminate about, is that they're just not as close to the business as they'd like to be. They get called when there's a problem or sort of in the end, at the later stages of a deal. And they'd love to be on the earlier side. And I was one of those lawyers who thought the same way. And so I went to AIG in 2003, which was an interesting time to be at AIG. It was before the financial crisis, but still a lot going on there. I realized it wasn't an area I wanted to be in. I wasn't doing insurance. I was doing these structured products. It wasn't AIG financial products. It wasn't what brought the financial system down. But again, it was kind of it was a very esoteric area, and I decided it wasn't where I wanted to be. So one of the partners I'd worked for at Sidley had moved to Millbank, brought me back, and I ended up doing a lot of leverage finance. Yeah. Short story long, I joined an investment bank the day after Labor Day 2008, which was the worst time in recorded history to join an investment bank. It was Barclays, and they just acquired, the week after I joined, they acquired Lehman. It was a pretty crazy 6 weeks. It was an amazing experience, but as often happens on Wall Street, once a bank acquires another, you do a reduction in force or a RIF. And I was, under the LIFO principle, last in, first out. I was clipped about 6 weeks after I got there, which was fine for me because you just didn't really want to be in a bank at that time. And I looked around and I started looking for something else. And Wyeth, this pharmaceutical, kind of was a little sleepy then, in the sense that it wasn't as well known as some of the larger ones like Merck and Pfizer. Was looking for someone with corporate experience. I went over there, and sure enough, 4 weeks later, Pfizer announces they're buying Wyeth, and that's how I got to Pfizer. Now, I had always done capital markets in securities, but always wanted to do M&A. And I was lucky that at the time I joined Pfizer, all their M&A lawyers had been plugged into different business units, and they didn't have anyone who could really do securities work. So I was they let me do. They hired me, and as part of the merger, my main mandate was securities work and tax structuring. And I liked the tax structuring because it was complex and it held my attention. But I really wanted to do M&A, and so I cut a deal with my boss, and he would let me do M&A once, as long as I had spare time. And he said, but he told me, but I think you're going to be pretty busy. And I said, I'll find time. And I did. And I started doing M&A, and about 5 years after I joined, and that was like 2009 that I joined, the end of 2009, I joined Pfizer. By 2014, I had done 5 years of solid M&A in addition to the other stuff. And Malcolm Gladwell likes to say 10,000 hours, you become an expert. You do the math. Yeah, that was the 10,000 hours. And so that's how I got into M&A, and pretty much worked on everything Pfizer did for about a good 12-year period. So I had a run from the beginning from Wyeth to when I left Pfizer at the end of 2020, 12 years of solid M&A corporate work.
So I have to ask, you've got a legal background. You love M&A. You've been on Wall Street. You understand deal transactions, but then you're stuck in the pharma world. So, I have my own story as to how, a business. I went to business school, and a poli-sci major undergrad ended up in the pharma world, which is kind of a strange story. But that
we have a lot in common, Ryan.
Right. We have a lot in common, right? You ended up in the pharma world, Stephen. And so what is it about the pharma world that excites you?
I think that's an excellent question. And I'll tell you what the answer for me is. It was 2014. We'd taken a run at AstraZeneca, and then we took a run at Allergan to do a merger that ultimately the IRS, the Department of Treasury, Jacob Lew, busted that deal up with changes to the inversion laws.
Remember that, yeah.
And at that point, I was thinking about leaving life sciences and pharma. I just, a lot of this stuff was, to me, little white pills, and I didn't really have much interest in that. It's not what I wanted to be focusing on. And then I got put on this deal where Pfizer was buying this company called Bamboo Therapeutics, which was a gene therapy company, and I had no idea what gene therapy was. And then I learned, and it blew my mind. And just, for those of your viewers who don't know what it is, Gene therapy is basically you take a virus that is not harmful in and of itself to the human body. You have some viruses, obviously, like the one we just got through COVID, that are that are very harmful to the body. These are called adeno-associated viruses. They're not harmful in and of themselves, and but they have a tropism or affinity for certain tissues in the human body. Some go right to the kidneys, some go to the liver, some go to the heart, some go to a bunch of different places. And we were looking at a company that had developed one of these AAVs, are called adeno-associated viruses, that they use as a delivery vehicle to deliver a missing gene to a human body to cure what's called a monogenic disease or an inherited rare disease. And these diseases are caused by the absence of one gene. So if you don't have, for example, the gene that's responsible for making factor 9, which then the absence of that factor 9 is hemophilia B, right? So, and it's made by one gene. So if you can make a copy of that gene, put it into a virus and use it kind of like a guided missile or a bus, take about 8 billion of those, put them into the human body, and you can target, for example, the liver, you can deposit enough functional copies of the missing gene that the body starts to express the missing enzyme, which is factor 9. You've effectively cured the disease. You provided a functional cure. You haven't changed your genetic makeup. You haven't integrated with a chromosome, but it's like a sidecar. It's sitting right beside there. Now, there's a lot of challenges to that, but that idea of using a virus to deliver a missing gene blew my mind, and it just completely changed my view of life sciences.
It's fascinating, Stephen, just even having this conversation. Like, you and I have known each other for a long time, but even having this conversation, we have so much more in common than I even thought. I was a poli-sci major in college, right? And one of the things that I love about political science is solving problems.
Yeah.
There are so many human issues, right? It's wealth distribution, it's affordable housing, it's economic development, it's clean water, it's and solving these issues which the politicians need to do, right? That for me, that was fun, that was challenging, it was difficult. And then I was introduced into the world of biotech, and it's almost the same thing. And I was quite surprised when I really got into the biotech space. And I think, just kind of mimicking exactly what you just said, like there are methods, there are mechanisms where we're just finding solutions to do things that are really our body knows how to do, right? Whole
absolutely.
concept is our immune system understands, like it's smart enough, it knows what to do. Sometimes we just need to remind it. I've got 12-year-old twin daughters, and you know what? They know that they've got to clean their bedroom, right? Sometimes they just need to be reminded to clean their bedroom, but they know how to do it.
Yeah.
Yeah, right.
Well, I would liken this to like dropping a Roomba in there, so that if they don't have the vacuuming gene themselves and they don't like to vacuum, then this is like dropping a Roomba in there.
No, I love the Roomba example. And what we're doing at CancerVax is we're essentially, all of our R&D is trying to establish and understand different biomarkers in different cancerous tumors. Once you identify that biomarker, now we can create an antigen.
Yep.
And much like what the COVID vaccine was, you simply supply the antigen to the human body, and you're informing the immune system that, hey, this little thing over here that was formed by your own tissues and your own vascular system that you don't really recognize, it's bad. Yeah, kill it. Right? Detect, mark, kill. Like that. That's it. Detect, mark, kill. That's what we're trying to do.
The one thing I would say is you use the adverb simply, and I would say simply in concept, but in practice incredibly complex, as you know. Your company has been around for as long as I've been practicing law, which is quite a while, and in different evolutions, and has been focused on this for quite some time. Gene therapy has been around for over 30 years. That's the area that I was focusing on, and they've had challenges. And so these concepts that should work. I had my CEO of my last company had a saying you never know what's going to happen when chemistry meets biology, right? Something should work, but it takes a tremendous amount of time, patience, and yet you still have to work with urgency.
Yeah, you really do. It's really interesting that you mentioned that. The last CEO chat that I had was with a very interesting guy, a PhD named Dr. David Beers, who's started and sold 4 cancer companies and is now running. He started it's an incubator, basically. It's a biotech incubator through the University of Utah. But that's really kind of what they think. They believe that it's just this combination, and you kind of have to have these things line up, right? And it's just super interesting. So, Stephen, listen, you have recently taken a new job, and I'd love to hear a little bit more about this because whenever you jump into something new, that's fun, that's exciting, and I'd love to hear a little bit about that.
Sure. So I actually there's as you know, there's a couple tweaks to that, and I'll just take it back one job. I left Pfizer at the end of 2020 to become general counsel of a company called Freeline Therapeutics, which is a gene therapy company and pursuing at the moment cures for functional cures for Fabry and Gaucher disease type 1, which both of them are what you call lysosomal storage disorders. So the body is missing a gene that creates an enzyme or a protein that clears out certain things in your body, like proteins or lipids, oils, basically fats. And if you don't have it, then you can start to have all sorts of terrible diseases. And I went there to be their general counsel at the end of 2020. Just really wanted an opportunity to accelerate my career, and really just had an incredible experience. Ended up the CFO left a few months after I got there, and so I ended up taking on some other responsibilities, business development, financing, just given my background in strategy, in addition to being the head of legal and head of compliance. And I really liked those areas a lot, and it was kind of a departure, or let's say a progression from what I've been doing for most of my career. And I decided when they hired a CFO again last May, that I wanted to pivot towards a business role. And so I decided to take some time off, and I've recently just agreed to become the interim head of business development for another gene therapy company. I haven't started there yet, so I'm not going to give their name. But I'm really excited. There's a bunch of folks there I know from my past life at Pfizer, and I'm really excited to join them, and really excited to do the business development work.
That's exciting. That really is. I'm happy for you. One of the folks that we are actually working with who's accepted a role. We have not publicly announced this yet, but he's accepted a role, so I'm going to go ahead and announce it. But he's a guy named John Sorrentino, and John was the former, I think either VP, but COO of vaccines for Pfizer.
Okay, I don't know him personally, but I did a fair amount of work with some of the vaccines folks, but unfortunately I don't know him. But that's great. Congratulations.
Our guy lives in New Jersey, of course, and
nobody's perfect.
That's right. That's okay.
I'm a New Yorker. That's why I say that.
There's a few good golf courses there, and that's why I can say that. So, but Stephen, listen, I would love to just kind of finish with one last question.
Sure.
I did not start my career knowing I was going to be in the field of sciences. Obviously, I studied political science and then went to business school, and then I worked for a venture capital firm, and we ended up investing in a cool little biotech company or idea out of a university, and that's how I ended up in the biotech space. That was 12, 13 years ago. And what's interesting is I've fallen in love with the biotech space, and as I'm have been for the past greater than a decade, surrounded by biologists and chemists and cell biologists and geneticists, I always tell them, hey, I'm a scientist too. I'm a political scientist, but I'm a scientist too, right? Tell me,
no, that's
what
great.
advice do you have as you know, as younger people or people who are just have a law degree, a business degree, this field is so big, it's so important. What advice do you have, Stephen, for people that are coming up that maybe have an interest in the biotech space?
I think that appreciate the opportunity. I think the most important thing is to really understand the science. And when I started at Pfizer, there was a lawyer there named Larry Miller. He's general counsel of another company now. He's been a successful general counsel of a couple of companies. And it was my first deal. We'd done a deal, and we were over in Europe together, and it was a bit tough. And there was a lot for me to learn in pharma, just incredibly complex. And he asked me, he's like, how did I feel about it? I said, I told him, I said, look, there was a lot for me to keep track of, and I feel overwhelmed. He said, look, it takes about 5 years to really understand life sciences. You put the work in, but be patient. But you got to put the work in, and I think that's the best advice that I can pass on, which is you either are. And what captivated me was the science, and I had not been a good science student in high school. I barely passed biology and chemistry, but it's because nobody could give me a reason to get into it. And when I got into gene therapy, when I learned about gene therapy, I finally had a reason to get into and understand and be excited by biology, chemistry. And I think the second piece of advice the first piece of advice I would give is, look, it takes time. And B, you've got to find something that appeals to you. And if it doesn't, that's fine. Go somewhere else. But if you find something that excites you and gives you passion, and again, gene therapy for me was it. It's not just gene therapy. It's just this idea, this ability of science to just create new ways of solving diseases and problems that you didn't even know existed. That to me was fascinating. So do the work, be patient, and find something that excites you.
Yeah, and I think I really think outside of science, that advice, Stephen, probably applies to any discipline, right? Be patient, do the work, and the benefits will come, right?
I think so. I think it's excellent advice for more than just biotech and again, advice other people gave me.
Stephen, listen, not only do I appreciate our friendship,
likewise,
and it's just fun catching up, and we need to do this more. But and I'll send you a text as soon as we're done here, so that we can kind of communicate and coordinate the next just personal visit. But thank you, thanks for your insight. Congratulations, really, on a brilliant career. And most people don't know. You hear a company like a Pfizer, but you don't know really what's behind it. Obviously, one of the biggest, most successful pharmaceutical companies in the whole world, but it takes people like you behind the scenes that are working hard every day to create new innovations, to protect patents, right, to structure new deals, and those are the things that allow us to have the medicines that that make us healthy and happier. So thank you.
Well, Ryan, right? You're welcome. You don't thank me. I mean, it's folks like yourself, the real risk takers, right? I analogize drug discovery to the film industry. You have big studios that are very good at production and distribution, right? You bring them a really good film and they can get it into the theaters. They can make lots of copies of it. You bring a drug company, a really successful drug, they have the manufacturing, the distribution, the sales force, they can get it out. What they don't have, and they don't like to admit it, but it's true, is that innovative, really just incredible engine. And it's not what they specialize in, right? They specialize in getting successful, approved product to patients in the most efficient way possible. It's people like yourself that make that possible by being the risk takers, by knowing that 9 out of 10 times you're going to fail, but if you succeed, you can change the world. And that's a very unusual type of person. It's a very special kind of calling, and it's like the independent filmmaker who has a script from someone nobody's ever heard of, got actors that no one has seen outside of a small little stage, and he's got a film director. He's got a camera guy who has never worked on a major film, and all these guys just happen one day to make a film that's incredibly successful and magical. And that's kind of what drug discovery is like.
And then it
fun
becomes
and magic.
Goodwill Hunting, right?
What's that?
Then it
Yeah.
becomes a Goodwill Hunting with, the discovery of not just a beautiful movie, but of Matt Damon and Ben Affleck, who wrote it as college students, right?
Yeah. Or the brothers McMullen,
Gosh, I can't believe you even said
Ed
that.
Burns.
I can't even believe you said that one. That is one of my favorite movies of all time.
Yeah. So you mentioned, we'll wrap up real quick. I did study international relations. I minored in Latin. I like to tell people I majored in BS and minored in useless. But Latin, I think, was great, and everyone should study it. But one of my classmates for 2 years was a woman named Maxine Bonds, who plays Eddie Burns' girlfriend in that movie, and also the subsequent one they did. So that's my little connection to that film.
I love it. That's so cool. It's funny. I've always thought that, and I say this probably only for my ego, but it's nice to hear you kind of reiterate it, that I consider myself and the work that I do as an entrepreneur in the biotech space really as kind of an extension, an R&D extension of big pharma. Our goal is it just never has been to develop a drug and get it all the way through the FDA and take it to market and then hire a bunch of salespeople to go sell the drug, right? That's just not what we do. Like, we're on the front end. We're the high risk. Mm-hmm. And what's really funny is my beautiful dear wife, who I love, her father had one job his whole life.
Yeah.
She married a guy who is a consummate entrepreneur. And the first, listen, we've been married almost 18 years, and the first greater than half of our marriage, she's like, why can't you just get just one job and just stay there? And I said, right. I can't do it. I can't do it. It's not in my DNA. I have right. to go create. I have to go build. I have to go create. And so thank you for those beautiful words, Stephen, because that actually really does mean a lot to me. There are people, and our calling is to just innovate and create, and then we have to hand it off. And oftentimes when you're in the early stages, like I am, you don't necessarily reap the same rewards as the guys who carry the ball over the finish line at the end. But it takes all of us, right? It takes a village, and there are important parts all along the way. And you're a huge cog in that wheel as well. And I appreciate all your work, and thanks for your time today.
No, it's a pleasure. Thank you for having me.